Today we are going to be discussing a citation that the Illinois Department of Public Health recently issued to Southgate Nursing Home in Metropolis after a resident there developed a severe post-operative infection. My name is Barry Doyle. I'm a lawyer in Skokie practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, a free report which spells out how the nursing home business model inevitably produces unnecessary injuries and deaths for nursing home residents. One of the common classes of residents that are seen in a nursing home are residents who are in for short-term rehabilitation stays, most often after having a significant illness or undergoing surgery. The resident who was involved in this particular incident was part of that class of residents who was admitted for short-term rehab after undergoing surgery. He'd had surgery to repair a broken ankle. And when the resident was discharged from the hospital to the nursing home, there was a series of discharge instructions that were given. These included to monitor the resident for signs and symptoms of infection, to leave the dressing in place, and to have the resident be brought to the doctor's office in 2 weeks. When the time came for the 2-week appointment, there was apparently a severe snowstorm. The doctor's office was closed. They canceled the appointment without a specific follow-up date having been set. Shortly after the initial appointment was canceled, the resident was diagnosed with COVID, which led to a 2-week quarantine of the resident. With these 2 delays in place, there was no effort made to reschedule the follow-up appointment for the resident, and so the first time that an appointment was set was about 6 weeks after the resident was discharged from the hospital to the nursing home. In the meantime, the resident had also been sent to the hospital for an unrelated reason. He'd been running a fever, and when he was brought to the emergency room, the assumption was that he was being treated for COVID. Lab tests were done which showed elevated white blood cells, which is in fact a sign that a resident is experiencing an infection. While the resident was in the emergency room physician called over to the nursing home. The nursing home staff told them that they didn't know who was handling the resident's orthopedic care, and that he'd been non-compliant with care, and that he was bearing weight on the broken ankle before he'd been cleared to do so by the doctor. When the resident was finally brought to the follow-up appointment 6 weeks after surgery was done, there were obvious signs of infection. There was a strong odor, which is something that's an indicator of an infection. The skin was red hot and inflamed, and the resident was sent from the doctor's office to the hospital. The resident was diagnosed with osteomyelitis, which is a bone infection. He had to undergo surgery to cut away some of the infected tissue and to remove some of the infected hardware. Ultimately, the resident's going to have to undergo an additional surgery to try to repair the fractures. The fracture is now in a state of non-union, meaning that it's not healed. He has to undergo 6 weeks of IV antibiotics to treat the MRSA infection that was causing the osteomyelitis, and is going to have a lengthier stay in the nursing home. Obviously, this resident is going to have a difficult, prolonged, complicated course in trying to recover from this fracture, assuming that he's able to do so. There were a number of shortcomings in the care that this resident received. The first being is that when the initial follow-up appointment was canceled with the orthopedic surgeon's office, it was the job of the nursing home staff to get the resident back on the schedule promptly. There was no effort made to do so, and then there was a further delay by the resident getting COVID. Regardless, anytime that the resident's return to the doctor's office was extended by delay, whether it was due to the weather or due to the resident getting COVID, it was incumbent upon the nursing home staff to reach out to the doctor's office to get additional information about how to manage the care of this resident until the doctor could see him. As it happened, the resident went 6 weeks without the dressing to this surgical wound being removed, because nobody could actually visualize the wound. This infection was allowed to set in and advance to the point where it worked its way into the bone, causing some destruction of the bone and requiring the extensive treatment that this resident had to undergo. Had proper follow-up care been provided by the nursing home staff, this is an outcome which in all likelihood would have been avoided. I hope you found this interesting. If you have any questions regarding this or any other nursing home abuse and neglect issue, please feel free to reach out to me. Our number is 312-263-1080, or we can be reached on the internet at www.accidentlawillinois.com. Thanks for watching.